Firstly, I would like to thank the Victorian Tumour Summits team for inviting me to speak for such an open and willing consumer engagement. Also to Ken Bottrell for his input and continued support. I'd also like to particularly acknowledge the patients and loved ones who generously gave up their time both prior to the summit and today, and thank them for their willingness to share their experiences with us. I know myself how difficult that can be at times. For me personally, bringing a group of patients and loved ones together to share our experiences was particularly powerful and really reinforced why we are here today. It's interesting how despite having diverse backgrounds and needs, when reflecting on our patient care, we all shared so many similarities, and I am so grateful to be given the opportunity today to share these with you on behalf of the group. Well, the focus of today is to discuss future improvements in lung cancer care. As the saying goes, you have to know where you've come from to know where you're going. After surveying and running a workshop with patients and loved ones from around Victoria, it was evident that there were things which went well throughout our care. From the doctors who were able to access treatments through clinical trials or not currently on the PBS, and the knowledge they could impart to help manage treatment side effects, to the nurses who were by our side during chemo, surgery or at home, providing compassion and support, and then to the surgeons, radiation therapists and wound management teams who made managing an early stage diagnosis and treatment plan prompt and smooth. It's important that we do acknowledge these positive experiences and the value each of you bring to our care and the hope that you ultimately provide. Each time you see a patient, you have such an enormous opportunity to positively influence our lives, not only to improve overall survival, but also to support us through this difficult journey, something that cannot be underestimated. So as we reflect on our experiences, my challenge to each of you today is to think about what you can do in your daily practice after you leave here today to immediately improve the patient experience, no matter where you practice or which demographic of patients you see. For patients and loved ones managing lung cancer, navigating the healthcare system feels like you've been ejected from an aeroplane mid-flight. The emergency lights have gone off, there's smoke and flames on the rear end of the plane, and you've had to hit the eject button not knowing where you're going to land or who will be there to rescue you. The adrenaline is high, and all you can do is hope that the parachute will release in time. If not, you'll find yourself smashing into the cold, deep ocean, scrambling to swim back up to the surface to gasp for air, and wondering how or if you'll ever make it to shore alive. While the majority of us will hopefully never have to eject out of an actual plane in our lifetime, every single lung cancer patient or loved one at some point will feel like they literally have. And here are some examples of that. I was told, here's your treatment, go home. But what's next and where do we go when we have questions? Our next appointment wasn't scheduled for 2 months. I met over 30 different doctors in 1 week and never knew who my direct contact person was. I was discharged with no clear idea of what would happen next. The report sent through to my GP was incomplete, so I suffered needlessly for another 3 weeks before being diagnosed. It was a distressing, worrying time. Throughout our discussions as a group, we identified that there were 3 key themes we felt could help us navigate the healthcare system more effectively. These were consistent two-way communication, aligning treatment and care with personal needs, and providing appropriate information and support. As we know, a lung cancer diagnosis is distressing and devastating for everyone involved. Without consistent, clear communication and a single point of contact from the beginning, patients and their loved ones often feel like we are left stranded in the middle of the ocean looking for a way out. More often than not, we are feeling completely overwhelmed and confused, thinking to ourselves, what just happened, what now? We need to know that two-way communication is important to you and feel like we are being listened to and included as part of the conversation all the time, not just sometimes. For at the end of the day, we are on the same team. What healthcare professionals tell patients is taken seriously and we will often follow your lead. But we need more guidance. We have no foresight for what will happen, so it's not surprising many patients and loved ones take it upon themselves to search for answers to questions they have. We know there are risks with using Dr. Google, but it's also very helpful. And what other options do we have when it feels like the only place we can turn to after we leave your rooms? Here are some examples of our experiences. I was constantly confused because I was told conflicting information or given vague answers. Lots of waiting and anxiety about not knowing clear next steps. I was comforted and impressed with the compassion shown by my nurses. They were never too busy to hold my hand or show sympathy when I was upset. When I moved into outpatients clinic, I found the communication very impersonal. During our discussions as a group, it became increasingly evident that treatment and care did not always align with personal needs, and that when dealing with a lung cancer diagnosis, it's easy to forget that there's so much to a person than just their lung cancer. Each one of us has physical, emotional, psychological, spiritual, social, financial, and even environmental needs that help create our wellness model. And this is what it can look like and feel like to us. What was not good was being very ill and having to organise taxis, appointments, shop, clean, etc. I never felt more lonely in all my life. During treatment, I had to attend 2 different hospitals daily for 52 days. I explained many times that I was alone and needed assistance with driving, but was not referred to anyone. I spent up to $800 in taxis, full fare. I've used services never recommended to me by my healthcare team, but these made a huge difference to my quality of life. Navigating shouldn't be up to the patient. During our most vulnerable times, we seek to find balance and support both from our healthcare team and within our wellness model. So when this doesn't align, we find it more difficult to cope, which greatly impacts on our quality of life. Finding the time to get to know what your patient's preferences and needs are is actually really important to us and can be incredibly reassuring during these vulnerable times. Often it's a difference between feeling like we are drowning at sea or being thrown a flotation device and given some respite. When we know which services are available to us, accessing them is easy. But how are we supposed to access services we never knew existed in the first place? For example, there is currently no consistency between when palliative care services are discussed or introduced as part of patient care. For some, it's immediately after a stage 4 diagnosis, while for others it's simply offered as a last resort. Many patients want to explore their options and be familiar with the supportive care services such as palliative care, but unfortunately, the opportunities to do so are not always provided. Discussing the cost of care up front, including travel, can help prepare families for what's ahead. Please don't assume what a patient can or can't afford, or underestimate the lengths some patients will go to financially. Provide all the options, be transparent, and allow the family to make the best decision for their particular set of circumstances. When healthcare professionals take the time to provide us with options about our healthcare and understand our needs and preferences, we feel safe, supported, accepted, validated, and a valued part of the team. It helps to build trust in the relationship and decision-making process. But most importantly, it reminds us that we are not invisible or alone. Currently, patients and their loved ones are finding there is lack of lung cancer-specific information being provided throughout our lung cancer journey. Upon initial diagnosis, a lot of what gets communicated to us is quickly forgotten, as the emotions are high. By simply providing us with relevant information or links to resources for us to read and digest at a later stage can really help to ensure critical information is retained. When patients and loved ones were asked who was provided with the lung cancer patient pathway created by Lung Foundation Australia, only one person had seen it the week prior, and she was diagnosed 18 months ago. It's such a shame that we have fantastic resources, but they're just not being used by the healthcare professionals or getting to the people that need them most. Without providing patients and their loved ones with points of contact to support groups, whether they be face-to-face, telephone, or online forums, the feelings of isolation, distress, and lack of self-worth will continue to manifest and contribute to the poor outcomes. This isn't new information, and I'm sure you've all heard it and read about it before, as outlined in Lung Foundation's Blueprint for Reform report. Connecting with our peers brings an unspoken empathy, mutual understanding and respect of each other. At times, it even offers optimism and hope, the value of which cannot be underestimated. So please find ways to connect patients with each other in order to minimise the distress and maximise the support. And here are some examples of where information or support were lacking. There was an education nurse when the patient underwent chemo soon after diagnosis, but nothing further was provided when the cancer returned or when it was identified as ALK. I did my own research and inquiries for information. There was some information at my chemo hospital, and I have used a lung cancer telephone support nurse through my own research. I was offered no additional support despite breastfeeding and being in a critically ill state with a 4-month-old and 3-year-old at home. So where would we like our health system to be? As we move through an era where treatments are more targeted and personalised, it's now time to shift our thinking towards personalising the other aspects of patient communication and care. We would like to see treating the whole person being made more of a priority, remembering that there is a person behind the disease. We would love to see care become proactive rather than reactive, clear and consistent and timely, with clear next steps, and ultimately have a single clear point of contact to communicate with throughout our journey. Provide us with contact details to organisations that patients can contact, such as Cancer Council Victoria and Lung Foundation Australia, and direct us to specific resources relevant to our cancer type. At a minimum, every patient should be handed resources such as Understanding, Managing and Living with Lung Cancer DVD, the consumer version of Cancer Australia's Best Practice Framework, and Lung Foundation Australia's Patient Pathway, to help guide them and their loved ones as they navigate. Alternatively, if we could mirror what is offered to breast cancer patients, such as direct access to a lung cancer nurse, it would help guide us through this process more seamlessly. While we recognise the workload and time restraints faced by healthcare professionals, and acknowledge that you cannot be solely responsible for providing the solutions we are after, hopefully today, with all the clinicians, consumers, project staff and government in the room, we can start to think about ways in which the patient-centred approach can be achieved, so that we are no longer feeling like we are drowning in the ocean with no way out, and start to feel more like we are about to be rescued by the support services team with minimal collateral damage. Thank you.